Dr. Prakash, karibu sana. Welcome to the Nation Studios. And my first question to you is this: what is cardiac arrest?
Thank you, Olive. Cardiac arrest is a cessation of cardiac activities. Means your heart rates become flat. Okay? That can be because of the several causes. It can be heart attack. It can be because of massive blood loss due to trauma, or it can be a massive clot in between your heart and lung. That is called cardiac arrest. So, after cardiac arrest, the patient become unconscious, and the window period to revive that patient is only 4 minutes. So, within 4 minutes, if you apply something called CPR, we call it cardiopulmonary resuscitation. So, there are chances of survival. You can revive that patient if you apply the CPR within 4 minutes, but every second delay after 4 minutes you increase chances of mortality, means risk of dying, and other organ failure. So, that is cardiac arrest.
Okay.
Yeah.
And what are the early warning signs?
Actually, cardiac arrest is a result of heart attack. So, I can talk about what are the early warning sign of heart attack. So, heart attack is different from cardiac arrest. So, heart attack is damage of cardiac muscles due to sudden stoppage of blood supply to the cardiac muscles, okay? And that makes heart muscles weak. We call it heart attack. Okay? That sudden stoppage of blood supply can be mostly is because of the lack of blood supply due to narrowing of the blood vessels, and most likely is because of the cholesterol. When cholesterol deposit in your arteries, we call it coronary arteries, it makes your blood vessels narrow. Okay? So, when it reaches up to 99-100% blockage, you get a patient get a heart attack, and heart attack patient present with severe chest pain, breathing difficulty, sweating, anxiety like fear of dying, and palpitation. So, those are the signs, symptoms and signs when the patient comes to the hospital. But warning signs of heart attack or any cardiac disease is like the most common warning sign is unusual tiredness, okay, in most likely in elderly, let's say after 40 or above. Okay. Unusual tiredness, okay, and you get breathing difficulty, you get short of breathing during walking long distance, during climbing stairs. So, you become breathlessness. So, that those are the warning sign of like impending heart attack.
All right, but those symptoms really, anybody who's out of breath climbing stairs, yes, really, should we all be concerned that we might suffer from a cardiac arrest? Are there more specific symptoms? Because when you talk about unusual tiredness, we've all on occasion felt unusually tired. So,
it's a good question. Let me explain. They are risk factor. They are risk factor for cardiac disease like hypertension, and another risk factor is poorly controlled hypertension. Diabetes risk factor, but poorly controlled diabetes is a major risk factor. Obesity, unhealthy diet, smoking, excessive alcohol intake, those are the risk factor. And also family history, strong family history, like if your parents have cardiac disease or your sibling have cardiac disease. So, those are the risk factor. So, if you look at the risk factor and warning sign, so if you are at risk and then you get those signs and symptoms, okay, we call them warning sign. So, that is how those are the warning, like they alert you for next step.
All right. So, what is the next step?
The next step is to get the checkup, regular checkup, control your blood pressure, control your diabetes, okay, and physical activity. If obesity, if you are obese, you reduce your body weight, okay, stop smoking. So, those are the you can prevent.
Okay? All right. I heard somewhere you can take an aspirin.
Aspirin, we talk about treatment. Aspirin is a treatment. Yeah.
if you're in that situation and you're saying you only have 4 minutes, should somebody get into cardiac arrest, what can they do before they get, and you talked about CPR. What if I don't know CPR?
CPR, you don't need to be a doctor to do CPR, don't need to be a nurse. If you have seen how CPR being done, or you have a basic, we call it basic life support. For basic life support, you don't need a medic, you don't need to be a medic. It can be a watchman. Okay? So if somebody become unconscious, the most common cause of unconscious is the cardiac arrest. So if you start CPR, it's a simple chest compression, okay, to pump the heart. Okay? So it supply the blood to the brain. Brain is the vital organ. Yeah.
All right.
So.
Okay. Thank you very much, Dr. A, for providing that insight. Dr.